Hello and welcome to today's episode. One of our followers, Fred from California, asked us if we could share our thoughts on improving knee strength or to prevent knee soreness or injury. Coincidentally, Lee Na just announced her retirement at age 32 due to chronic knee pains. Okay, so here we go. I'll be talking about possible injuries, why you experience knee pain, what causes knee pain, treatment options, and workout recommendations. Most athletes will experience knee pain sooner or later during their career, which is probably the reason why you are watching this video right now. There are numerous possible injuries that can occur. Some are less severe, others require surgery and rehabilitation. In order to come up with the proper diagnosis, knowing the location and severity of the pain can help. Possible injuries include patella and quadriceps tendinitis, patellofemoral pain syndrome, ligament sprains and tears, and fourth, we got meniscus tears. Patella and quadriceps tendinitis, also referred to as jumper's knee, is an inflammation of the respective tendons. You will feel an aching or sharp pain just above or below the kneecap or patella. Patellofemoral pain syndrome occurs due to repetitive compressive or shearing forces or muscular imbalances, for example due to lateral tracking, where the patella is out of alignment, which leads to compensatory muscle action. Usually you will have an aching pain around and below the kneecap. When you have ligament sprains or tears, you often experience overall joint instability. When you have a meniscus tear, then the pain is either inside, called medial meniscus tear, or outside, referred to as lateral meniscus tear. So why do you get knee pain? Well, tennis players can experience knee pain because of various factors such as overtraining, muscular strength imbalances, and flexibility issues. As a result, the musculature surrounding or acting on the knee joint, such as the quads, hamstrings, abductors, adductors, and calves, cannot handle the stress placed upon it, which oftentimes happens when the knee protrudes over the toes, which can occur during on-court tennis training and strength and conditioning. These are factors that tennis and strength and conditioning coaches are responsible for because they are in charge of developing the athlete. If you have an athlete that is a workaholic or does extra work on his or her own, then communicate with the athlete to convince him or her that being healthy is paramount for improving his or her ranking and ultimately a successful career. Keep in mind that the athlete will lie about their pain levels because they want to play tournaments to earn points in order to improve or maintain their ranking. What they don't understand is that this kind of behavior will backfire because the body will break down and more severe injuries can occur, which means weeks of no training and loss in confidence and performance, and hence a downward spiral with regards to ranking. The coach's job is to make the best decisions for their athletes. Whatever the situation may be, the training volume needs to be adjusted accordingly and regular physical therapy needs to be implemented so that injuries can be avoided or minimized even if the athletes are resisting. Okay, so what can cause knee pain? The aforementioned injuries can occur due to excessive knee flexion and rapid knee extension activities during on-court tennis training and strength and conditioning. During on-court tennis training, this can occur during excessive serving, where you can see the knee flexion and rapid extension during the service motion, or the single leg squat during the landing or deceleration phase. Excessive volleying, such as the forward lunging during the low volleys, or excessive serve and volleying, where the transition from single leg squatting during the landing phase and rapid knee extension during the push-off phase can cause knee pain. Now, during strength and conditioning, improper form of execution during squatting, forward lunging, lateral lunging, biking, or downhill running can occur where the knee protrudes over the toes. Intensity can be too high, for example, too much weight is being used, or we have insufficient recovery in rest intervals, muscular strength imbalances, or flexibility issues. Okay, so now treatment options and workout recommendations. First, if you experience pain, stop playing tennis or physical conditioning immediately because you don't know if the injury is serious or not, and the risk of causing or aggravating an injury is higher than any possible benefit. 2. Get checked out by a sports-related physician, athletic trainer, or physiotherapist who has extensive experience with the knee joint, because the knee is a complex joint and the risk for misdiagnosis should be minimized or avoided. Third, once you are pain-free and have clearance to engage again in physical activity, you can start with the stretching, strengthening, and balance exercises presented next. Okay, good morning guys. So today we're going to show you a dynamic warm-up routine that you can do with your athletes on the court. We're going to have a few exercises that Alexander is going to demonstrate for us, while I'll give you some pointers why they are important or what the purpose is, which musculature they warm up, so just stay with us. Okay, here we go. Okay, so we start with the high knee pull with dorsiflexion, meaning he's also going to go on his toes. So we're going to warm up the glutes, the adductors, and also the calves with that one exercise. Next we have the butt kicks, which warms up the quads and the front of the leg. Following by straight leg kicks, so we want to warm up the hamstrings. You really want to see that you do it in a controlled fashion, so that it's not going to be too fast so you don't pull anything. Next we have the single leg RDL with quad stretch. This is an exercise also for balance, so hopefully you'll keep your balance while you do it. So you warm up the quads in the front as well as the hamstrings. And we have stability as well for the one leg action. Next we have the diagonal lunge with rotation, which basically mimics a ground stroke in closed stance. So you're in the diagonal lunge, you rotate to the right, to the left, come up. So you want to start rotating to the side first, wherever the leg is in front. Good. And also make sure that the upper body really rotates, so it's not just arm swings, but the upper body rotates. Next we have the lunge with overhead reach. With this stretch, we're going to stretch the ab muscles as well as the latissimus dorsi for overhead action. Okay, next we have the piriformis. It stretches the piriformis muscle, which is located towards your butt. Very important for lateral movement. Okay, next we got the duck walk. So you really want to try to get as low as you can. Really opens up the groin area, also the glutes, and it's really good exercise. And last but not least, well actually we have a couple of more exercises, but this is the lateral lunge. You really want to be careful. The first few repetitions you do, really do it slowly, because otherwise you might tear your adductors. Really be careful with that stretch the first few times you do it. Okay, we got the inchworm. Yeah, well, we are men, so we can do the inchworm here. If you have the ladies, so you have to go on your hands, so you want to tippy toe up. It's also a great exercise for your calves, for your ankle basically, and you also get some hamstring action involved. So if you don't want to get your hands dirty, you can also do it next to the court on the grass. And that was it. That's basically a very, very quick dynamic warm-up routine that you can do with your athletes. I'm going to show you a few exercises now that you can do with your athletes to improve knee strength and avoid knee soreness. Now you can load them however you deem appropriate, using a barbell or dumbbell respectively. Okay, so the first exercise we're going to do is the back squat. Here in this case I'm using a Smith machine, that's how it's called, because we have the two rods where the barbell is basically just moving up and down. Now the Smith machine is good if you want to focus on prime mover development in the exercise, because the barbell cannot move in any direction, so just up and down. So here you would focus on the glutes and the quads in this exercise. Now, if you want to develop stabilizers as well, then do it outside of the Smith machine, just using the barbell and weights, because then the body needs to stabilize everything. Okay, so now here we go. So the position is as follows. You want to position the feet underneath the shoulders, or maybe a little bit wider at the shoulders. And you want to distribute the weight through the heels so that the knees do not protrude towards the toes. Okay? So here we go. You want to also have the chest out, shoulder blades together, and here we go. And you also want to go as down as that the knees are at a 90-degree angle. Now we're going to do the forward lunge into the reverse lunge using dumbbells, but you can also use it with the barbell, loading it on the top of your scapula. Okay, here we go. Want to make sure that the knees are at 90-degree angles, so take nice large step forward and reverse. Okay, now we're going to have lateral lunging, meaning we do lunges sideways in sideways fashion. So you also want to make sure you distribute the weight through your heels so that the knees do not protrude over your toes. Okay, so here we go. Then you can start with the feet close together. Do a large step outside, the toes point slightly outwards, and now you're going to go down into the lunge. You can the arms in front, it's a little more easy this way to stabilize the action. Push off back to the center. Same thing to the other side, toes point out slightly, and keep the weight on the heels, and push back to the center. And again, 1, 2, 3, and 4. And same thing here, you can load the action using a barbell if you want, or dumbbells, whatever you deem appropriate. Next exercise is going to call the Romanian deadlift, or RDL. In this case I'll be using dumbbells to perform it, but you can also use a barbell and attach weights accordingly. Okay, here we go. Okay, you position yourself that the knees are underneath the shoulder. You have a slight bend in the knees, so we call this athletic stance. Okay, then you hold the dumbbells in your hands, and now all the action occurs in the hip. Basically, you're flexing the hip to 90 degrees and then extend it in this position. Okay, here we go. Okay, make sure you go down again until the knees are at 90 degrees. Keep the back flat. You can do this by looking forward and keeping the shoulder blades together. And then you come up again. Again, the entire action occurs in the hip. This is an exercise that targets the hamstrings, meaning the back of your thigh. Okay, next we're going to have knee extensions. We're going to use the machine for this so that we can isolate the quadriceps and increase strength there. So again, you want to make sure on the side here that in the side panel you have usually a red dot or a mark on the machine. That needs to be in line with the knee joint. You also want to make sure that the lower back is supported by the bench. Okay? Also make sure to make the exercise controlled fashion upward and downward face. Many guys just use a lot of weight, get it up, and then drop the weight. You don't want to do that because you want to get the most out of the exercise. So you want to have the muscle action coming up, as well as during the deceleration phase, you also want to control it. Okay? Here we go. Up slowly, and now return slowly. Now if you cannot use that much weight, that's okay. It doesn't look cool, but you do the exercise correctly. All the way down, all the way up. And down, and up again. Okay, the next exercise is going to be the knee curls, and it targets the hamstring musculature at the back of your thigh. Again, same thing with the machine here in this case. You want to make sure you're in the extension, knee extension. You usually have a mark on the machine, so you want to make sure it's at the same level as your knee. Okay, here we go, same thing. You want to make sure on the downward face you control it, same way on the upward face so that you get the most out of the exercise, okay? Use less weight if necessary, but you want to make sure you perform the exercise in perfect form, okay? Here we go. Curl, you can hold it down there for a second and slowly come up in a controlled fashion. Again, down, you can hold it a second and slowly return. Okay, so here in this exercise we isolate the hamstrings, and it's very, very important because many athletes actually have strength imbalances, quads and hamstrings. So you want to make sure that you keep the imbalance as small as possible, or that you actually get rid of it completely. That's the goal. Okay, the next exercise is called the single leg RDL, or single leg Romanian deadlift. Now this exercise also targets the hamstrings like the Romanian deadlift, where you have both feet on the ground, but since it's single leg action, we also have stability requirements. So this is actually a stability exercise to engage all the stabilizer muscles acting on the knee. Here we go. Again, you have the dumbbell in one hand, and the same side that you hold the dumbbell, that leg also remains on the floor. Okay, so again, you're in the position, one leg, dumbbell is in your right hand, and now again the action is just in the hip. Okay, so look forward during the exercise and stabilize everything. Do it slowly in a controlled fashion, and that's it. Now the next exercise is going to be the single leg squat. Also great for stability purposes. So basically, again, your one leg action, the other leg you can have in front, it's a little easier. You can also keep the arms in front, and then you go down in a controlled fashion and push up. So it's not much of a movement, but you want to be stable all the time. Again, you can load the action also using dumbbells in your hand if you want to progress, whatever you deem appropriate. Okay, next exercise we're going to be doing dumbbell calf raises. So you have two dumbbells in your hands, keep them there, all the action is from the calves. So you want to make sure that you position your feet underneath the shoulders, toes are pointing forward. Okay, here we go. So basically you push up and you hold the position for a second before you lower it down again. So that's it for today's workout session. I hope you paid attention and enjoyed the exercises. Well, that's it again for today's episode. As usual, opinions differ. What's your point of view? Let us know below in the comment section. A brand new episode will be available next Sunday. So make sure you don't miss it and subscribe. In the meantime, I recommend you watch some of the previous episodes. You should really watch them all. If you like what you saw, tell your friends. I'm sure they will appreciate it. I'm Philipp Halfmann. Thank you for watching and auf Wiedersehen. Tennis Conditioning TV episodes are licensed under Creative Commons. You are welcome to link or embed these videos, forward them to others, and share these ideas with people you know. Brought to you by Advanced Concepts of Strength and Conditioning for Tennis. Available at tennisconditioningbook.com. Music by Dan O at danosongs.com.